Okay, welcome everyone. It is 2:30, and so we're going to go ahead and get started. You are in the right place if you're here to learn about the 2013 Texas Health Perception Survey results. I have two wonderful presenters here for you today. I have Dr. Deanna Helsher and Dr. Diane Dowdy. Just a quick introduction of our speakers. Deanna Helsher is the John P. McGovern Professor in Health Promotion and Behavioral Sciences and Director of the Michael and Susan Dell Center for Healthy Living at the University of Texas School of Public Health, Austin Regional Campus. Her research interests include child and adolescent nutrition, school-based health promotion programs, dietary assessment methodology, evaluation of child obesity policies, and dissemination of school health programs. Dr. Diane Dowdy is currently an assistant professor in health promotion and community health sciences at the Texas A&M Health Science Center School of Rural Public Health. She has a long history of leadership in the development and implementation of programs at multiple levels, community, state, and national activities. Ladies, welcome so much, and I'll hand it over to Dr. Helsher.
Thank you, Brooks, and welcome to everyone on the webinar. We're very pleased to talk to you today and share our work. This grew out of a collaboration between the UT School of Public Health and the Texas A&M School of Rural Public Health, a previous project we were working on, and it kind of evolved into this. So we're really happy to be doing this. Today's presentation is going to focus on the project overview, so tell you a little bit about the project and the different parts of it, the methods behind it, then about key findings. And what we've done is organize the key findings around attitudes on childhood obesity, influences on health issues, the use of health-related resources, support for obesity initiatives, and then communication of research findings. And then finally, we'll have some time at the end for questions. So why did we do this survey? One of the things during the last couple of legislative sessions, we know that there's been quite a bit of turnover of the legislators. And so in the session before this one, more than 50% of the legislators were new. And so we did not really have a good handle on their perceptions about obesity prevention and control measures and their attitudes about the subject. And so we had discussed doing this with several of our partners, and then were later funded by Robert Wood Johnson to do just that. So our project timeline, we began the project in November 2012, at which time we received funding, and we put together a survey, a quantitative survey. So there are two parts to this project. One is a quantitative survey, and the other part is a series of qualitative interviews. So the survey was developed between December 2012 and February 2013, and we adapted it from previous surveys and then had a lot of input from our advisory committee, which we'll mention later in the presentation. We also, after November 2012, were able to compile legislator contact information, including who would be their designated aide in charge of health issues. From March to October, then, we administered the survey. And we administered the survey either online or in a hard copy, or we did it in person as an interview, whichever way we could obtain the data. And we administered the interviews with an aide, usually speaking on behalf of the legislator, or whoever the legislator designated as their respondent. We also did some data analysis and compiled means and also percentages. And then the last few months we've been working on compiling this into a report, which was released this afternoon, and then this presentation. So we were very pleased at the excellent participation rates for this survey. Over 46% of the legislators, so we had a sample size of 83, completed the survey. And this was pretty much evenly divided between Republicans and Democrats, with 69 House members, 12 Senate members. And then we had two surveys that did not indicate whether they were House or Senate members. Then we had an additional 16 legislators complete the interviews. For the survey, we targeted, or we wanted it to be done among all legislators. For the interviews, we looked at certain legislators in particular, those that were on certain committees such as the Public Health Committee, or those that were members of the Farm to Table Caucus. So this slide shows the demographics of the participants in the study. And as you can see, most of them had held a previous elected office, with the most common being a county legislative office or a statewide office. We were especially interested in seeing that over half of them had served as a legislative staff member prior to being elected as a Texas legislator. And now I'd like to turn this over to Dr. Dowdy.
Hi, thanks. All right, we're going to start with the information related to the attitudes of legislators for toward childhood obesity in Texas. And one of the first questions that we asked is, we asked the legislator or the legislator staff person answering as the legislator or through the legislator's perspective, how much do you agree or disagree with the following statements? We had a total of 15 comments that we asked them to either agree or disagree on. And on this, it's a scale of 1 to 5, 1 meaning strongly disagree to somewhat disagree, 3 is neutral, 4 is somewhat agree, and 5 is strongly agree. And what we found is that in terms of agreement, health occurs where we live, pray, play, work, and attend school was the highest, had the highest agreement, level of agreement. And this was the mean across the respondents. So as you can see, that's pretty high. One thing I'll just mention now is one thing that we were pleased to see or we found interesting was the high level of agreement in many situations. You can imagine if we have a score of, or a mean of 4.6, then we didn't have a lot of difference between 5 and 1, because that would have brought the score down lower. So there was a lot of agreement here, a mean of 4.6, and that was the highest. Then we also had a good bit of agreement for the issue of much can be done to lower the incidence of childhood obesity. Similarly, schools can have an effect on childhood obesity. And again, similarly, there's a link between healthy diet and academics, and the Texas legislature should enact policies that support health and wellness. Then on the next slide, you see that we continue with these comments where we ask them to show whether they agree or disagree. And health is everyone's business was still in the agreement column. Childhood obesity is a family matter. That was highly agreed upon. And there's a link between physical fitness and academics. And we found this is interesting for both the physical fitness and the healthy diet. They acknowledged the link between those issues and the academic performance. And then obesity prevention is a matter of personal responsibility. This was pretty high. It's going down slightly, but not to the point where there was a great deal of disagreement between the respondents. And parents are primarily responsible for their child's weight. There was a good bit of agreement there at 3.94. Now, in terms of on the next slide, you see that we started to move down in terms of the level of agreement. One thing that I wanted to point out is legislators believe 3.76. Some of them feel as if they have a good bit of knowledge related to overweight and obesity issues, and obviously some are more toward the neutral end of that. But I do want to point out, as you can see through the various columns there, The one thing that was very low and makes sense to all of us is that children will outgrow obesity without intervention or help. And that says there definitely is an opportunity for us to do something to change this situation of childhood obesity in Texas. It sounds as though, it looks as though the legislators realize that there does need to be some intervention or help. So what we asked them next was what influences their decisions on health issues. And one thing that we wanted to point out are some of the key findings in this area. What legislators believe is parents, families, and individuals do have a large role in fighting obesity. That brings it home to the parents and families. Also constituents, scientific research, and district data, both local and county, are most important factors related to supporting health issues or legislation for the legislators surveyed who responded to the survey. And that tells us that they're identifying they like the local information. They need the local information to know what the needs are for their particular area and their constituents. And also we were pleased to see that they were open to scientific research as influence on their decision making. Also, committee chairs are most influential in determining health priorities, and then they also identified the value and need for healthcare organizations as being an influential source of information on health issues. Next, we asked how much of a role, trying to get drill down to specifics in terms of issues and situations that might influence. How much of a role should each play in each of these issues, or individuals or groups play in fighting the obesity problem in Texas? And there were 20 options that the legislators could respond to or identify. But instead of providing all of those, we actually just gave you the top 4 and the bottom 4 to see where the real discrepancies might be. And this, I need to point out that the graph shows it's a different scale. It's on a 1 to 4 scale as opposed to the 1 to 5, meaning that 1 is no role, 2 is a minor role, 3 is some role, and then 4 is a major role. And here we see, repeated again, the importance of parents and families in terms of fighting the obesity problem, identifying the parents and families as key. Individual and personal is also very high on that. So there was a lot of agreement that there were issues that it's that personal and family responsibility. Then healthcare providers also quite high at 3.58 mean, and then the communities 3.43. So really keeping it local, keeping it focused with the family and also with healthcare providers. The bottom 4 groups that were seen as not as strong in terms of role in fighting obesity, we have the farmers, employees, restaurants, and then lowest was transportation groups, which we'll talk about a little bit later as well. Okay, then we asked how important are the following factors in determining which health issues you support. And remember, we were trying to, there's not a right or wrong answer. We were trying to figure out what was in the mindset of the legislators and what their particular situation might be. On this, once again, we're back to the 1 through 5 scale. So 1 being unimportant, 2 being little importance, 3 moderately important, 4 is important, and 5 very important. So you can see again with so many up in that 4+ area, we have a great deal of agreement in terms of these issues are important. First and foremost is the constituents' needs or opinions. So the legislators are really speaking to and identifying the needs and their local individuals or people that they represent as being key in terms of which issues they are more likely to support. Scientific research, again, very high at 4.55, and data on health impact in my local area was high as well. Then we went to the personal interest in the health issue, a local leader that the individual trusts, and position of advocacy groups. And so there's a fair amount of agreement, but obviously less attention or less influence from the local leader or position of advocacy groups. And for this question, all 6 of these options, we're presenting you information on the potential response for all 6 of those responses. Okay, and then we asked, how important are the following when deciding on legislation? And as you can see, driver again is the local, the district data, the constituents, the county data, the local data. So it's important to know how it impacts the state. Obviously, as the state data was a mean of 4.0, but much higher in that calculation or in those numbers, you see the district or county or local information. And then social media was in fact lower than all of the others. So we also asked, what's the relative influence of the following individuals and groups in determining health priorities in your chamber on a scale of 1 to 5, with 1 being no influence and 5 being major influence? Obviously, there's a high influence from the committee chairs, and then special interest groups and elected leadership, legislative staff, state agency leadership or staff. But then we go down not so much for the other chambers or mass media. How influential are the following sources of information to you as a state legislator on health issues? Once again, we had 21 options, so rather than consume the presentation with all of the options, we decided to go with the top 4 and the bottom 4, where we saw the most diversity in terms of the responses. And what we see here, which was interesting, is the healthcare organizations was the highest at over 4, and then the personal expertise, mental health organizations, and public health organizations. So it was really interesting that they identified mental health organizations as one of the key sources of information as well. And we were, being from schools of public health, we were really excited to see that public health organizations were in the upper tier as well. But then in the lower tier, we have lobbyists, statewide elected leadership, faith-based organizations, and media. Okay, now I'm going to talk just a moment about the use of health-related resources. And with this, we have some key findings. The legislators believe that they see the TMA, news sites, and health sites are useful resources for obesity, nutrition, and physical activity information. Then we also have the fact that they look at data specific to Texas, and obviously, as we've heard before, the local, their own district's information as an influential factor for obesity measures. And then also they did identify that they felt that more interim studies on obesity in Texas should be performed, which is indicative of an interest in trying to figure out what can be done and what should be done and how they might address it. So we asked, do you use any of the following resources for obesity, nutrition, and physical activity information and policy? And highest on this, with the scale of going back to the 1 to 4, with not at all being 1 and 4 being a lot. We have Texas Medical Association at 3.06, and that was good to hear in terms of going to individuals or groups that might be credible individuals. Online health sites, online news sites, public newspapers, others, and then, interestingly enough, CDC was the lower end of that. So I think that gets back to the issue of local and resources that they can tap. So how would you like to receive public health and obesity related information? The majority of them indicated they prefer to receive this information via email, then also website, written information, and personal communication. And these will be issues that Dr. Helscher identifies and speaks more to a little bit later. But one of the things with email, they said, you know, when they receive the email information, rather than having an attachment to it, they really like to have the information in the body of the email. And then if it's a more formal document, you can attach it, but they do like to be able to open the email, look at the information, and know what it is you're trying to share. What would make research more useful to legislators? Providing hard numbers that are specific to Texas. That became a common theme, obviously. Communicating frequently with weekly or biweekly reports. So don't try to overwhelm them with the information all at once, periodically, and expect them to read all of it, but really get the information in short spurts or snippets, and make it credible and easily understandable, digestible format. And then really look at when this information is shared, not just on an ongoing basis, but really maximize the exposure to the information during the interim period so that they're not overwhelmed with legislative responsibilities during session. And then providing the information they need to know in the document with links to more information. That was important as well. So now I'm going to turn it back over to Dr. Helscher, and she'll speak more of the survey.
Thank you very much. So the next part of the survey discusses what the legislators felt about different obesity prevention measures. So a lot of these were initiatives that were either proposed or on the docket during the past legislative sessions. So what we found is that legislators in general support obesity prevention and control measures, especially those that focus on educating the public and especially parents there. So several of them mentioned things like cooking classes or ways of teaching parents about nutrition and physical activity. Other ways of improving health, especially through schools or child care centers, or increasing access to healthy foods. So a lot of the themes had to do about incentives rather than being punitive. One of the things that they also supported was not limiting or prohibiting the sale of items or advertising. And so we'll talk about that a little bit more. And then finally, an underlying theme was balancing government responsibility with self-responsibility and looking at funding as big obstacles for obesity prevention measures. So we gave them a series of 8 statements, 8 policy recommendations, and asked them, would you support or oppose these? And this was on a scale of 1 to 5, with 5 as strongly support and 1 as strongly oppose. So the first few policies on the policy recommendations had to do with schools. So the coordinated school health programs that increase physical activity and nutrition education and health education in high schools, as well as increasing access to healthy foods, specifically fruits and vegetables, and improving nutrition and physical activity in early childhood programs were very close in scores across each of those. So the first two, the first one, the coordinated school health programs, is especially interesting because there have been a concentrated effort to get mandates around coordinated school health programs in the Texas Legislature since 2001. So this is kind of a continuation of some of the work that's been done. So it was nice to see that there was general support for that. Health education in high schools was also interesting, as there are currently no recommendations for health education in high school. So that is definitely an opportunity with the support that's shown here. Increasing access to healthier food was cited quite a bit, especially fresh fruits and vegetables. So a lot of times this had to do with farmers markets that they mentioned are ways to locate supermarkets or food markets in food deserts, places that don't have a lot of supermarkets. And then finally, early childhood programs. We'll see this theme come up again. There was general support for early childhood across several different recommendations. The next group of policy recommendations included improving health of children by health measures through SHACs, which are school health advisory councils, and this shows having local control to change nutrition and physical activity at the school level. Enhancing community environments to promote physical activity was also supported a bit, as was evidence-based strategies, which reduce obesity and its cost. This is especially interesting to us because some of the evidence-based strategies that were mentioned included measures to address sugar-sweetened beverage consumption. And interestingly enough, in some of the qualitative work, evidence-based was not always seen as a positive term. It was seen in more of a mixed light. And when probed on that, a lot of the legislators or their aides said it just depends who's doing the evidence, and there's lots of forms of evidence. So that by itself is not necessarily a term that you want to use without qualification. And then finally, there was less support for nutritional guidelines for food sold in vending machines in state facilities and agencies. The next group of 8 policy recommendations have to do with environments, so policies to kind of govern the environments. And so as you see, the first 2 that rated highly were providing healthier school lunches and more physical activity in schools. So this is very consistent with the coordinated school health programs that we saw in the previous group of policies. Again, we have the same scale here, where 1 is strongly opposed to 5 is strongly support, and those 2 came in at about 4.5. Next, you'll see about educating parents about childhood obesity and healthier eating habits, and finally, the next one that was highly supported was ensuring new schools and subdivisions are walking and biking friendly. So this is pretty consistent with what they had indicated support for previously in healthy communities. Again, you see that encouraging state agencies to provide healthier foods through vending and cafeteria was supported, but then the next 3 environmental standards or practices had more of a neutral evaluation, particularly prohibiting the sale of sodas, chips, and candies in either school cafeterias or school vending machines. So these were more moderate to neutral support. And then finally, limiting television ads for unhealthy foods that are targeted at young children really had quite a bit of opposition. These last 3 of all the questions that we asked received the most opposition. The strongly opposed or somewhat opposed compared to strongly support or somewhat support. So when we ask legislators about how you pass childhood obesity prevention measures, we ask them which measures are important to you in terms of priority. And as seen before, early childhood programs really came out with strong support. So the legislators One of the reasons that they gave is there is licensure for these early childhood programs, and there's federal programs. There's federal guidelines. So adding additional guidelines, you already have a foot in the door. So it's not necessarily coming up with new guidelines that haven't been in place before. Again, using the shacks or the local control to improve the health of school children so that more of the decision making is at the local level, and then enhancing the environment. And we saw that through both school physical activity and walking environments in the community. As far as which measures they thought had the greatest chance of being included in the 83rd legislative session, which was this previous session, again you see improving early childhood programs, as well as evidence-based support to decrease sugar-sweetened beverage consumption. One of the reasons we think that it was here and that was mentioned in this particular interview was that it was mentioned in the Legislative Budget Board report. And so that might have had something to do with it being mentioned as part of the interviews. When asked about what obstacles you see in attempting to pass measures related to childhood obesity, what we found is there really was a concern about balancing government responsibility with self-responsibility. So where do you draw the line? Where can the government make changes, and where is it your own responsibility? In that place, what we saw is that childhood obesity was very much supported, whereas adult obesity was less supported. Finding funding was also an issue for several of the legislators, and it was very interesting to note that several of the legislators really were mindful about proposing funding for new legislation, especially when they knew that it might be in place for 10 years or 20 years once they were gone. So they really tried to be fiscally conservative as much as possible. They also saw that obtaining community buy-in was important, and one of the things that they mentioned was their reliance on the constituents, which Dr. Dowdy mentioned. And a lot of times some of these initiatives are not seen as having as broad a support as some other initiatives that kind of rise in priority during the sessions. So this is an opportunity for people who are interested in promoting nutrition and physical activity and obesity initiatives, trying to obtain more community buy-in and support. And then finally, adding more education mandates for public schools was seen as a big obstacle. A lot of the constituents made it known to the legislators that there are a lot of unfunded educational mandates, and adding one more, even if it is for a good cause like nutrition or education or physical education, is difficult for the schools to handle, especially when the budgets have been cut. We did ask them about 3 other general public health policies that were outside of nutrition, physical activity, and obesity. And we asked these questions just within the focus groups, within the interviews. So there were only 16 that responded to this. But basically what we found is, although there was strong support for policies and plans that support individual and community health efforts, there was a mixed response to preventing Texas from vaccine preventable disease, and the response was a little bit more mixed even for supporting smoke-free public areas. So this is consistent with what we've seen in terms of the smoke-free legislation the past few years. So the final component that we asked them about were communication of research findings. So how can we as researchers more effectively communicate to the legislature? So what we found is legislators believe that health professionals and researchers are the most credible messengers on childhood obesity, and that a lot of times building these relationships can really be helpful, visiting legislators and keeping it as an ongoing relationship rather than just showing up when the legislation is at committee hearings or what are up for a vote. It's also very effective having testimony where you have both data and then personal stories interspersed. So the most credible messengers on childhood obesity were were mentioned by the legislators included health professionals, and especially they pointed out pediatricians, and then researchers, especially those in higher education. And we also found that in general the higher education in terms of schools of public health tended to rank higher than just general universities, and probably because schools of public health had health as one of the major components of their name. As far as which terms resonated more, what they preferred was the use of childhood obesity, since it's specific and it spells out the problem with more of an urgency. Also, there was considerable comment about how childhood obesity we still need to is part of the community, where it's everybody's responsibility, whereas adult obesity can be seen as more personal responsibility. They also said that health and wellness could be viewed as too broad, so they didn't think that they were specific enough to describe the topic. So as far as engaging your colleagues, basically what you can see here is a lot of relationship building, so really establishing a relationship early, visiting with legislators. Just today when we gave the presentation, we heard from some more legislative aides that now is a great time to reach them because they're not crazy busy like they will be during session. So they really like when they have a little bit of time to digest this and really talk to people. They also mentioned starting small and getting some small victories and building on that, which has been done a lot with several of the coordinated school health initiatives in the past. They talked about interest groups, their constituents, and local media often. As Dr. Dowdy had mentioned previously, they often look to their local media. So that might be an interesting venue to appeal to legislators. They also talked about triangulating the data with personal stories. So however you can gain stories, a lot of times here we've been collecting with our research success stories that are often very effective. Photo voice might be another good idea in terms of this. And then finally they said get to know the legislators, meet with them before it gets down to the testimony. By the time it gets down to the testimony, a lot of times they said it was a little bit too late to really have the influence you might want to have. So what did we learn overall? We learned that there actually is a lot of common ground among Texas legislators for obesity initiatives, and much more than we had originally anticipated finding. And this was especially for school mandates, child care regulations, early childhood, access to healthy foods, and as I mentioned before, especially fresh fruits and vegetables. And then education, especially for parents. So things like cooking classes, parenting classes, those were actually seen as something that would be real positively favored. We also learned that communications and relationships need to be ongoing and really established and nurtured now, and that Texas and local level data are important. So all of those were conclusions of our health perception survey. So finally, I'd like to acknowledge the many grant partners we have on this project. So we work together with the Michael and Susan Dell Center for Healthy Living, the UT School of Public Health, and then Texas A&M Health Science Center School of Rural Public Health. So this was a true collaborative project across the state. We also had a fantastic advisory committee. The Texas Medical Association helped quite a bit, as representatives from the Texas Hospital Association, the Texas Health Institute, the Partnership for a Healthy Texas, and the American Heart Association. And then finally, I'd like to acknowledge the project members. Besides Dr. Dowdy and myself, we had staff that really pounded the pavement quite a bit at the Capitol, and we're very persistent in terms of going and obtaining our high survey rate. So we're very thankful to them and would like to acknowledge their contributions to the project. And just in closing, I'd like to say that the project was funded by the Robert Wood Johnson Foundation, and we're grateful for that support. And with that, I'd like to turn it over to Brooks.
Yeah, and thank you so much for a great presentation. Very informative and obviously a lot of really interesting information presented. So we'd like to open it up for questions. So you'll see that on your screen you should have a box where you can type those in and submit them, and we'll give you a second if anyone would like to submit questions, and I'll facilitate here. But if Dr. Helsher, you could go to the next slide. I'm sure the first question on many of your minds is, where can I download the report? And actually, if you go to our Twitter account at MSDCenter, we just tweeted out the link, the direct link to the report, so you can go there and download it. It's also available through the MSDCenter.org website, and a direct website link to the report page is the tcopy.org page. That's spelled TCOPPE.org. Sorry we didn't have that link printed on the slide here. We just did this presentation live, so we had that handed to people. But anyway, if there are any questions at all, go ahead and type them in. I'm not seeing any coming in yet, so I'll give you guys just a minute here. But one of the questions that did come up, I'll go ahead and ask from the live event we did a little over 2 hours ago. That was interesting was talking about the local data being so important, but asking, well, what's the next step in getting this local data? Are there funding obstacles? Is that linked together? How do we get local data that if they're wanting it so much? How does that need funding, et cetera?
Oh, local data, it's one of those interesting questions that everybody wants, but it's really difficult to do. Number one, the infrastructure isn't really in place to obtain local data. A lot of times you need the staff to collect the data, you need appropriate instruments, you need to have a sampling plan, and those resources aren't always available at the local level. As well, funding for these kind of surveys are not always available. In Texas, we've been fortunate for childhood obesity because we've had the School Physical Activity and Nutrition Survey, so SPAN data. So we do have some data. It's not necessarily drilled down to the school or county level, but at least we have it by public health region and state level. Also, CDC has several tools to look at obesity data. In particular, the Behavioral Risk Factor Surveillance Survey, and then the Youth Risk Behavior Survey. For certain areas, for certain cities and municipalities, there are data at that level. But beyond that, it's kind of hard to drill down much lower.
Okay. Another question that came up was, what are the next steps for this survey? Are there plans to go beyond with this or future surveys? Could you answer that?
We would really like to, we see this as the first step. This is, we got a great response from the legislators. Obviously there's interest, and then we've had a tremendous amount of interest in the findings because we like to think that this information is helpful. Our hope is that we're going to be able to do this survey again. We see the legislature as an evolving group of individuals, and as that group changes, it's important to know what their beliefs, their understanding, their expertise, where they are in their thinking to be able to address this issue in a meaningful way. So we'd like to see this be just the first opportunity, and to follow up with the next legislators and next group of legislators, and then also look to see what opportunities are, what questions come up that we might be able to address in the interim as well. So there are a number of things that we're going to do with this. We have presentations, and we're more than happy to share the information. As Brooks indicated, the report will be on the website as well as this presentation, so we're accessible to individuals as they have questions. Deanna, was there anything else you wanted to
Stay tuned.
Yeah, absolutely. Well,
more to come. Dot.
Exactly. Well, thank you all very much for attending today. We hope you found this informative. Like I said, if you want to download the full report, you can go to our Twitter account at MSDCenter, and we just tweeted out the link. If you have any other questions come up, the contact information is on the screen there. You can reach out to us via social media as well if you prefer. And as Dr. Dowdy said, this presentation will also be has been recorded and will be put on that website as well. So thank you again for attending, and have a great rest of the day.